Then also notes we provide that are basically CBME based, having question answers and MCQ. Then also MCQs are there that are from beginner level to expert level. Then also student can book a personalized counseling session for direct interaction with the counselor. And also we have some subscription plans starting from basic to premium. So basic plan is of 3 months, standard plan is of 6 months, and premium plan of 12 months. And premium plan includes services like pre-recorded class, live class, live doubt clarification, then one-to-one personalized guidance is there, notes is there, quick revision examination module is there. So I would recommend all the students to take premium plan so that you can have access of all the features of Auricle. And also for instant 20% discount, you can use my code Aanchal20. So let's proceed with today's topic. And here we are having some core features of internal exam marathon. Like in this series, we provide rapid revision of all the important topics, and also volatile facts are there. For quick revision, then multiple choice questions will be covered, and also we assure top-notch grades in the examination. So in today's class, we're going to discuss all these important topics: cardiac output, hypervolemic shock, compensatory mechanism, long-term regulation, chemoreceptors, JVP, and arterial pulse. So first, we're going to start with the cardiac output. So as we know, what is cardiac output? Cardiac output is the amount of blood pumped from each ventricle, right? So cardiac output is amount of blood pumped from each ventricle. And also it refers to left ventricular output through aorta. Okay, so cardiac output is the most important factor in cardiovascular system because rate of blood for flow through different part of the body depend upon cardiac output. So cardiac output basically depends upon two things. The main things are, first is stroke volume and the second is heart rate. So whenever we wanted to know the cardiac output of a person, so first we have to determine the stroke volume and heart rate. Then after that we can calculate the cardiac output. Okay, so first we should know that what is stroke volume and what is heart rate. Okay, so stroke volume is the amount of blood pumped out by each ventricle during each beat, and it is the difference between end-diastolic volume and systolic volume. Okay, so whenever we want to know that what is cardiac output, we should first know what is stroke volume. So stroke volume normal is 70 ml. Right? And heart rate, as we know, the heart rate is defined as the beats per minute, right? So it is 72 beats per minute. Okay, so after multiplying stroke volume into heart rate, we can easily calculate that what is cardiac output, right? So now heart rate also depends upon nerve innervation and also depend upon hormones, and also stroke volume depends upon blood volume and vascular resistance. And also there are several factors upon which the cardiac output also depend. So that factors we're going to discuss. Those factors includes So, variation in cardiac output, we have several factors like age, right? So, in children, cardiac output is less because less volume of blood is present, and cardiac index is more than that in adults because of less body surface area, right? Now, next factor we have is sex. So, in female, cardiac output is less than in male because of less blood volume, and cardiac index is more than in male because of less body surface area, right? Now, next we have body build. So, greater the body build, more is the cardiac output, right? Lesser the body build, less is the cardiac output, right? Then also the variation according to the time. Okay, so cardiac output is low in the morning and increases in daytime, and also it depends upon the basal condition of the person, right? Now, next we have environmental temperature. So, whenever there is moderate change in temperature, that actually does not affect cardiac output, but whenever there is increase in temperature above than 30 degrees Celsius, so ultimately that temperature is going to affect cardiac output, and if there is increase in temperature, then ultimately the cardiac output will also going to increase, right? Now next we have emotional changes. So anxiety, in the condition like anxiety, excitement, nervousness, right? So all these condition will cause the increase in the cardiac output about 50 to 100% through the release of a very important hormone, that is catecholamine, which increases the heart rate, and also force of contraction will increase. So ultimately cardiac output will also increase. Now what happened after taking the meal? So during the first hour after the meal, the cardiac output usually increases. And we have the exercise. So cardiac output increases during exercise because there is increase in heart rate, and also force of contraction also going to increase. Then next we have what happened whenever any person visit to high altitude. So as we know, in high altitude the cardiac output increases because of secretion. There is a secretion of a hormone that is known as adrenaline. Okay, so if that hormone adrenaline will going to increase, so ultimately the adrenaline secretion is stimulated by hypoxia. Hypoxia is the condition that mainly the lack of oxygen, right? So ultimately the cardiac output will also increase. Okay. Now the another thing, that whenever there is change in posture, right? So while changing from upright position, right, the cardiac output decreases. And the last we have sleep. So cardiac output is slightly decreased, or usually it is unaltered during sleep. Okay. So cardiac output may be decrease, or maybe it remain unchanged during sleep. Okay. So these are all the variation that we notice in cardiac output. But whenever we talk about the pathological variation, so in pathological, there will be increase in cardiac output in condition like fever, like anemia, right, in hyperthyroidism. And there will be decrease in cardiac output in the condition like hypothyroidism, in shock, or in case of hemorrhage. Okay. So this is about the changes. Now next we have the regulation. So as we can see in the flowchart also, that whenever sympathetic activity increases due to the secretion of epinephrine or due to the secretion of adrenaline. So ultimately, it will cause the increase in the heart rate, and also the force of contraction will also increase. Or whenever there is any change or increase in the venous return. So venous return will increase due to intrinsic control. So end-diastolic volume ultimately will increase, which increase the strength of cardiac contraction due to Frank-Starling mechanism. So this will cause the increase in the stroke volume, and if both heart rate and stroke volume will increase, on which the cardiac output depends. So ultimately this will cause the increase in the cardiac output, right? Now some other factors also which are responsible for maintaining cardiac output, so that we're going to discuss, in which first we have venous return, then force of contraction, then heart rate, and finally peripheral resistance. So one by one, we're going to discuss. So first we have venous return, right? So what happened? Venous return is basically the amount of blood which is returned to heart from different part of the body, right? So whenever there is increase in venous return, the ventricular filling and cardiac output is also going to increase. So cardiac output is always directly proportional to venous return. Okay. Now this venous return also depend upon some factors like respiratory pump, muscle pump, gravity. Okay, so one by one, we're going to discuss those factors also. So respiratory pump is basically the respiratory activity that helps the return of blood to heart during inspiration, right? So that's why it is also known as abdominothoracic pump. So what happens during inspiration, the thoracic cavity expands and makes the intrathoracic cavity large, right? So there will be interthoracic cavity, pressure will become more negative and it will increase the diameter of venous of inferior vena cava, resulting in increased venous return. So at the same time, there will be descent of diaphragm, increases the intra-abdominal pressure, which compresses abdominal vein and pushes the blood upward the heart, thereby the venous return will increase, right? So in flowchart also, we can understand that during inspiration, there will be expansion of thoracic cage. There will be more negative intrapleural pressure. So there will be increase in diameter of inferior vena cava and it will cause increase in venous return. Okay. Now, next we have muscle pump. So basically, muscle pump is the muscular activity that help in return of the blood to heart. And what happens whenever we do any kind of muscular activity, whenever we do any kind of exercise or physical work, so the veins are compressed or they get squeezed. Okay, so due to the presence of walls in veins during compression, the blood is moved towards the heart. So when muscular activity increases, so venous return will be more, and this will also cause increase in cardiac output, right? Now, next we have gravity. So what happened? Gravitational force reduces the venous return, and when a person stands for a long period, gravity causes pulling of blood in the legs. So whenever there is more pulling of blood in the legs, so because of venous pulling, the amount of blood returned to heart decreases. So the gravity will cause decrease in cardiac output. Okay. So this is all about venous return. Now next we have force of contraction, right? So force of contraction is again directly proportional to cardiac output. Okay. That is provided by Frank Starling law also, that force of contraction of heart is directly proportional to cardiac output. So whenever the force of contraction will increase, so cardiac output is also going to increase. Also, this force of contraction will depend upon two factors, that is preload and afterload. So what is preload? Preload is the stretching of cardiac muscle fibers at the end of diastole just before contraction, and it is due to increased ventricular pressure caused by filling of blood during diastole, right? Another thing we have here, we are studying force of contraction factors. Okay. Another thing we have afterload. So what is afterload? Afterload is basically, this is the force against which the ventricle must contract and inject the blood. So force is determined by the arterial pressure, and at the end of isometric contraction period, the semilunar walls are open and the blood is injected into the aorta and the pulmonary artery, right? Now next we have heart rate. So heart rate already we have discussed, right? So as we know, cardiac output is directly proportional to heart rate, right? So basically, whenever there is moderate change in heart rate, it will not alter the cardiac output. But if there is marked increase in the heart rate, so ultimately the cardiac output is going to increase, right? Then next we have peripheral resistance. So peripheral resistance is the resistance offered to flow of blood at the peripheral blood vessels, right? Now the peripheral resistance is the resistance or load again which the heart has to pump the blood. So cardiac output is inversely proportional to peripheral resistance. So whenever the cardiac output will increase, so ultimately peripheral resistance will decrease, or whenever peripheral resistance will increase, so cardiac output will decrease. So this is all about the factors, the varied factors on which the cardiac output depends, right? Now, next we have long-term BP regulation. So basically, kidney kidney play an important role in the long-term regulation of arterial blood pressure. And when blood pressure alters slowly, right, in several months or in days or in years, the nervous mechanism adapts to the altered pressure and loses the sensitivity for the change, right? It cannot regulate the pressure anymore. So it's in such condition, the renal mechanism operates efficiently to regulate the blood pressure. So that's why it is known as long-term, because it takes long time, right, to change. So kidney regulates pressure by two methods, right? First, we have by regulating ECF volume. Okay, and second we have through RAS mechanism, that is renin-angiotensin mechanism. So both we're going to learn. So first we have renal body fluid control mechanism. Okay, so what happened whenever there is decrease in blood volume or salt ingestion, right? So it means there is a kind of dehydration in the body. So that change will detect by the osmoreceptor. So because whenever there is dehydration, so means the blood osmolarity is going to increase, means the amount of solutes in the blood is going to increase, and that change will be detected by the osmoreceptors that are present in hypothalamus. So in that change, they will stimulate posterior pituitary gland to secrete a hormone that is known as antidiuretic hormone or vasopressin, and also the thrust center will be stimulated. So thrust center will be stimulated and it will cause the person to drink more amount of water, and also the ADH secretion will cause water retention by your kidney, and both the condition will be responsible for increasing blood volume and decreasing the blood osmolarity, right? So in this way, by regulating of extracellular fluid volume work. And next we have the RAS system. So this is the important one, and also we're going to discuss. So whenever there is decrease in blood pressure, so it will cause stimulation of JG apparatus, right? It will cause stimulation of JG apparatus. It will cause to secrete a very important hormone that is known as renin, and renin will cause the conversion of angiotensinogen to angiotensin 1. Okay. Now, this angiotensin 1 will get converted into angiotensin 2, right? With the influence of a very important enzyme that is ACE, angiotensin converted enzyme. Okay, that is present in lung. Now, this angiotensin will going to convert into angiotensin 3. And finally, this angiotensin 3 is going to convert into angiotensin 4. Okay. So now this angiotensin 2 is responsible for two things. First, it will cause the vasoconstriction of the blood vessel. Second, both angiotensin 2, 3 and 4, they will cause the stimulation of adrenal cortex gland. Okay, so we know that in adrenal gland, we have two parts, adrenal cortex and medulla. So both the angiotensin 2, 3 and 4 will cause the stimulation of adrenal cortex. So it will secrete a very important hormone, that is aldosterone. And aldosterone will stimulate kidney so that it will cause more reabsorption of water and sodium. If there will be more reabsorption of water and sodium, so ultimately there will be increase in ECF, right? That was the motto of this whole system. So if there will be increase in ECF, so there will be increase in blood volume. And also the vasoconstriction that was also done by angiotensin 2 will cause more and more sorry, there will be increase in ECF, then blood volume will increase, and ultimately the normal BP will be there. And also this vasoconstriction will help in doing this normal BP. Okay, so this is all about RAS system. Once again, we're going to understand this again. So whenever the blood pressure and ECF volume decreases, the renin secretion from kidney will increase, and it converts angiotensinogen into angiotensin 1, and this convert into angiotensin 2 with the help of angiotensin converting enzyme that is present in lungs. Now, this angiotensin is going to act in two ways to restore blood pressure. First, it will cause constriction of arteriole in the body so that the peripheral resistance will increase and the blood pressure rises. And also angiotensin 2 constriction of afferent arteriole in kidney so that the glomerular filtration will reduce, right? Now, this angiotensin 2 stimulates the adrenal cortex also with the 3 and 4. So this hormone is responsible for the reabsorption of sodium from renal tubules, and so sodium reabsorption is followed by water reabsorption, resulting in increase in ECF, and the blood volume increases so that the blood pressure will also become to normal. Okay, so this is all about the RAS system. Now, next we have arterial blood pressure. So what is arterial blood pressure? It's basically arterial blood pressure, arterial pulse. Not pressure. Pressure already we have done. Arterial pulse is defined as the pressure changes transmitted. Pressure changes transmitted in the form of wave, right? Through arterial wall and blood column from heart to periphery. Now, what happened during contraction of left ventricle? As we know, the blood is ejected into the aorta, that is also forcefully, right? So, this ejection will cause the distension of this blood vessels, and there will be rise in pressure. Now, a pressure wave is produced on the elastic wall of aorta, and it travels from the heart and can be felt after a brief interval at any superficial peripheral like radial artery at wrist, right? So normally we check the arterial pressure with the help of radial artery, right? So that we're going to learn that basically whenever we do observation of artery, so observation during examination of pulse depend upon several factors like rate, like rhythm, like character, then volume, and also condition of blood vessel wall. So about that we're going to discuss. Okay. So first we're going to discuss about the rate. So basically what is rate? The pulse rate is the number of pulse per minute. Okay. And it has to be counted for at least 30 seconds, right? So pulse rate in adults is 72 beats per minute. And also the pulse rate will be different at different age, and also the pulse rate can be increased in several conditions like during exercise, pregnancy, emotional condition, fever, anemia. Okay, so at these conditions the pulse rate can increase. Okay, now next we have rhythm. So rhythm is the regularity of pulse, right? So it refers to interval between beats. If the interval between beats is the same, so the rhythm is normal. But if the interval between beats is variable, so we will call it as the irregular rhythm. Okay, so normal under condition the pulse appear at regular intervals, and rhythm of the pulse become irregular in some condition like arrhythmia, okay, arterial fibrillation, extrasystole. So in these conditions, the rhythm can be irregular. Okay. Now next we have corrector. So corrector denotes the tension on the vessel wall produced by the waves of pulse, and it is usually evaluated at right carotid artery. Okay. Now next we have volume. So volume, as we know, the volume, the amount of blood is that is going to flow. So volume is the determination of movement of the vessel wall. Okay, so produced by the transmission of pulse wave, and it is also a measure of pulse pressure. It depends upon the condition of blood vessels. Now last we have the condition of vessel wall. Okay. So condition of wall of the blood vessel is assessed by feeling the radial artery and rolling it against the underlying bone. So when we talk about the normal condition, normally the wall of the vessel is not palpable in children and also in young adults, and in old age, the wall of the vessel wall become rigid and palpable. So in abnormal condition, like in the condition of atherosclerosis, it is felt as a hard rope. Okay, so this is all about the arterial pulse. Now next we have JVP. JVP is jugular venous pressure. Okay, so first we know what is venous pressure. So venous pressure is defined as the pressure changes transmitted in the form of waves from right atrium to veins near heart. Okay, so venous pulse is observed only in large vein near the heart, such as jugular vein. Okay, so observation of venous pulse is an integral part of the physical examination, right? Because it reflects right arterial pressure and also the hemodynamic events in the right arterial. Okay, so now we're going to learn about the examination of venous pulse. So inspection of jugular venous pulsation is routinely done by bedside examination of neck vein, right? As we can see in the diagram also. So it provides valuable information about the cardiac function. So to observe the pulsation of internal jugular vein, the head of the subject is tilted upward, as we can see in this diagram. Okay, so the head should be tilted upward at 45 degree. Okay, now in the patient with increased venous pressure, the head should be tilted as much as 60 degree. And the pulsation of jugular vein can be noticed when light is passed across the skin overlying internal jugular vein with relaxed neck muscle, and also simultaneously palpation of the left carotid artery helps the examination, whoever the person is doing that, to confirm the venous pulsation. Okay, now we're going to learn about the recording, like what we get in the recording. So recording is basically recording of jugular venous pulse is known as phlebogram. So phlebogram we're going to learn, and that we're going to learn with the help of this wave. Okay, so here we have A, then X, C, X1, V, and Y. Okay, so the recording of jugular venous pulse is known as phlebogram. It is similar to like that intra-arterial pressure curve. Okay, so like intra-arterial pressure curve also, the phlebogram is also has three positive waves. Those positive waves are A, C, and V. And also have three negative waves, that is X, X1, and Y. So one by one, we're going to learn about all these waves. Okay. So first we have A wave. Okay. So as we know, this is the first positive wave, right? So this is due to rise in arterial pressure during arterial systole. Okay, and also it precedes ventricular systole. Now next we have the X wave. Okay, so this is a positive wave, this is negative wave. Okay, so the X wave is a negative wave due to fall in arterial pressure. Okay, so whenever there is fall in arterial pressure, that is represented by X wave, and it coincides with arterial diastole, and also this will lead to the beginning of ventricular systole. Now next we have C wave. So C wave also we have the Positive one, right? So C wave is a positive wave due to rise in arterial pressure during isometric contraction period. Okay, now during this period, the arterioventricular valve bulges into arteria and increases the pressure in the arteria slightly. Okay, now next we have X wave. So X wave is also the negative one. Okay, so this is also negative wave due to fall in arterial pressure during ejection period, and during ejection period the arterioventricular ring is pulled towards the ventricle, causing the distension of arteria, so the arterial pressure will fall. Okay, then next we have V wave. So V wave is again positive one. So basically, V wave is also positive due to rise in arterial pressure, and the pressure increase because of filling of arteria, means during venous return. Okay, it is obtained by during isometric relaxation period or during arterial diastole. And last, finally, we have Y wave, that is also the negative one. Okay, now this Y wave is a negative wave which donates, basically there is, whenever it appears, whenever there is fall in arterial pressure, and pressure fall due to opening of arterioventricular wall and impeting of blood into ventricle. Okay, this wave appear during rapid and slow filling period. Okay, so this is all about the waves. Now, we should also learn some applied part, that whenever there is elevation, increase in JVP, so it can be due to the causes like bradycardia, or due to tricuspid stenosis, or due to pericardial effusion. Then another reason could be pulmonary hypertension. So in these conditions, there is sudden increase in JVP, right? Now, next we have the another topic, that is hypervolemic shock. So the question over the hypervolemic shock can come, and also this is the important one, okay? So as the name suggests, hypo, right? So hypervolemic shock means the shock due to decreased blood volume, right? Decrease blood volume. Okay. Now, shock due to decreased blood volume can be due to increased vascular capacity, due to any cardiac disease, due to obstruction to blood flow, right? So these can be the causes. Okay. Now, shock due to decreased blood volume is known as hypovolemic shock, or another name is cold shock. This is also known as cold shock. Okay, so whenever there is loss of intravascular volume in cardiovascular system, so it will ultimately leads to hyperperfusion of organ and tissues. Okay, and the causes can be blood loss or fluid loss related to certain chronic condition or due to any therapy. Okay. Now, it occurs when there is acute loss at least 10 to 15% of blood, and loss of blood less than 10% may not produce any significant effect because of immediate compensatory mechanism that is already present in our body. Okay, so we're going to learn important manifestation of hypervolemic shock. Okay, so it can be due to decrease in cardiac output, then whenever low blood pressure, or whenever thin thready pulse appear, or could be due to pale and cold skin, or whenever increase in respiratory rate. So these are the things that are basically, these are the important manifestation of hypovolemic shock. Now also we going to learn the pathological condition when hypovolemic shock can come. Okay, so pathological condition. So whenever the question over the hypovolemic shock will come, so first you have to define that what is hypovolemic shock, what are the causes, then manifestation you can define, then also the pathological condition, which is a very important part you have to learn. Okay. So the pathological condition like hemorrhage. Okay. And it will lead to hemorrhagic shock. Okay. Then another condition could be due to any kind of trauma, and it will lead to traumatic shock. Then due to blood loss in case of surgery, right? It will lead to surgical shock. Then in case of any burns, and it will lead to burn shock. And finally, if the person is suffering from the condition like dehydration, so it will lead to dehydration shock. So one by one in detail, we're going to learn about all these shocks. Okay. So first we have hemorrhagic shock. Okay. So hemorrhagic shock is basically is the shock due to hemorrhage, the condition of hemorrhage. So acute hemorrhage can be present in the case if the person is having accident, right? And shock is not produced in chronic hemorrhage that is caused by ulcer. Okay, so this is all about hemorrhage. Now next we have traumatic shock. Okay, so as we know, trauma means serious injury or what caused by some external forces, right? So shock caused by trauma is known as traumatic shock, and shock occurs due to damage of muscle or damage to bone, which is common in battlefields also and in case of road accident also. So apart from loss of blood, the plasma escapes to the tissue space. Okay, so various symptoms of traumatic shock are there, like crush syndrome is there, reperfusion injury is there. Reperfusion injury means dysfunction of myocardium or blood vessels or any tissue, okay, which is reduced by restoration of blood flow to previous ischemic tissue. Okay, now next we have surgical shock. So surgical shock is the shock that is developed by or that is developed during any surgical process. If any person is suffering to any to having any surgery, and if there is sudden loss of blood, okay, so it will consider as surgical shock. So surgical shock develops due to some reason like internal hemorrhage or external hemorrhage or dehydration that occurs during or after surgical processes, right? Now next we have burn shock. So burn shock is the shock that is produced by the effect of burn, and in burn loss of plasma through the burnt surface is more than the loss of whole blood, and it decreases the ECF volume. The extracellular fluid is going to decrease, and also the plasma volume is going to decrease. That will result in hemoconcentration, and this leads to sluggish blood flow, which decreases the cerebral blood flow, causing the shock. Right? Now, next we have finally the dehydration shock. So as the name refers, dehydration, right? So shock due to dehydration, whenever the person is suffering from the condition of dehydration. So dehydration means decrease in water content of the body. So decrease in the blood volume result in dehydration shock. So all these type of shock is considered under hypovolemic shock, means all these condition will result in low blood volume or low ECF content. Okay. So these are all the regions of hypovolemic shock. And if the question over the hypovolemic shock is going to come, then you have to define about all these shocks. Okay. So this is all about today's class. And also we have covered all the important topics. And also if you have any doubt, then you can connect us with the platforms, right? You can connect us through Instagram, YouTube, Facebook, and Telegram. So I hope you find this class helpful. So thank you so much for watching this class.